but I might have
Okay.
accidentally
Says
closed
it-
out of it, but we're good.
Says you're live.
Yeah, you're on YouTube. Yep, that's going and good.
Well, my watch says it's 5:30. Let's go ahead and call the meeting to order. Good afternoon, everyone. This is the regular meeting of the Health and Human Services Board for July 23rd, 2020. Welcome to the members of the public who are watching on our county YouTube channel. Given this technology, there won't be any public comment today. So I'll go ahead and call the roll. Bonnie Barker.
Here.
Larry Bjork. He was here.
Yeah. You went somewhere.
He went somewhere. All right. Well, let's hope
Evidently.
that he's here. We'll call him here.
Okay.
Chairman Bartlett. He's here.
Here.
Sarah Kennedy.
Here.
Jody Cromrie.
Here.
Bill Lamb does not appear to be here. And it looks like Sarah Schaefer has just logged in. We'll call her here. Welcome, everybody.
I'm here.
Thank you, Sarah. Welcome. We would need a motion to approve the June 18, 2020 minutes of the board.
I so moved.
Supervisor Steen,
I'll second.
Bonnie Barker. Any discussion? Any concerns, corrections, additions? If not, all in favor of approving the June 18 minutes, signify by saying aye.
Aye.
Opposed? Minutes are approved. Item 4 on the agenda, the next meeting of this group is August 27th. It's going to be an important meeting because that's our first review of the budget. So August 27th at 5:30, and we'll obviously let you know if it's in person or via Zoom.
It will be via Zoom because I have to publicly legal record notice it.
Right, that's right.
And I sent it out yesterday saying it was going to be via Zoom. So
okay, perfect. Oh, perfect. Okay,
Yep.
That's good.
And the other thing that will be on that agenda, so I think that typically that budget meeting goes a little bit long because you need to hear the all three of the department proposals, and then we've also been asked to put the county's legislative agenda on the August meeting, so that will be a discussion item as well. So
okay.
So bring your dinner.
Okay. Okay. Wear your pajamas. Okay. 5, Department of Public Health staff report. Katie Gallagher, are you on?
I am. Sorry, I was trying to check a voicemail really quickly and I totally got caught. Oh my goodness.
Oh my goodness, you got caught. You're here now. Thank you.
I am. So we're jumping into my report, I understand. So what I'd like to do is share my screen.
Hello,
right.
everyone, by the way.
Yeah, let the record show that Mr. Lamb has joined us.
Fantastic. So what you have today up on the screen, I did send out via email about a half an hour before we started our meeting. So if you had any trouble getting a hold of that, let me know. And that's just so that you could access the links in all of this. So this is what we're calling the SITREP or situational report. And so this is dated from yesterday so that we could pull all of the data. And you can get a breakdown on our current cases as of yesterday. I'll talk about today's cases and then the cases added to that that aren't representative in our data portal. But the nice thing about this SITREP is that it shows you a couple things from Johns Hopkins about where we are in the community, gives you a couple different metrics. And then also in the SITREP is our surrounding counties and national data. So if you wanted to see where we were in comparison to the world and Wisconsin for COVID-19 exposures. We have talked quite a bit about, actually we haven't talked about this, community exposures. So one of the things that you may or may not have seen is that we had to publicly notice that there are exposures associated with 2 bars. I had a wonderful phone call with an older lady who said, I don't know what the market and the arena are. Have I been there? And so we talked through what they actually were, and we were quite certain that she was not. The difficulty is when we do contact tracing, we want to know where those folks are that have been exposed so that we can get them to stay home through voluntary quarantine. What is difficult in some of our cases with the Nap Water Sports event and with this particular case is that they don't know who they were around. And you'll see that oftentimes in gatherings with loose connections of friends where people are in very close contact with one another. They might not know each other's full name, but they'll know how to get a hold of them on Snapchat or some of the social media sites. And that is exactly what we had with this particular situation, is that they were with a group of friends and they had snapped all of them to let them know that they needed to contact us, and none of them did. Shocker. So because we couldn't make those calls and actively pursue those contacts, we had a responsibility to publicly notice that if folks were at the arena or the market, between 8 and 2:30, depending on what location they were at, they needed to monitor for symptoms. And if they had any symptoms, they needed to go talk to their doctor. We are working a couple of outbreaks associated with bars in other counties. We have positive cases in Dunn County residents. We don't currently have any secondary cases from either of these 2 locations, and we are working with those locations to keep it that way. They did agree to close and do a deep clean, and their staff will monitor, and my hope is that we won't have any other cases. Just so that you guys are aware, in situations where we can effectively contact trace and a business or an event is in that time frame when the individual that was positive for COVID-19 was symptomatic or pre-symptomatic, we are working with that business quietly in the background to do all the contact tracing that we want to do. And they are working with us very closely on keeping their clients and their staff safe, oftentimes closing. Sometimes we have businesses that are just a contact and they choose to close and clean, which we are not requiring. So do know that a lot of things are happening in the background to keep our community safe as it relates to both cases and contacts to cases. All right, so moving through some additional information. This is the hospital information. And then there's a resource list, and I'm not going to go through all of those, but if you have some questions, you can click on those from your email. Sorry.
Hold on 2 seconds. Diane, I bet your so your little this guy,
Yeah.
if you lean on him, you'll turn him down. You should have a plus and a minus. See if that helps.
Doesn't seem to be doing anything.
Can you hear me now, Diane?
Might be working. Huh?
There's a plus and a minus on there.
Oh. Oh, there we go. Sorry. Techno glitch. Apologies.
Are
Go
we
ahead,
good to
Katie.
go?
Yeah,
Okay,
go ahead,
fantastic.
Katie. Sorry.
And so this is something I didn't put in your packet, but I'm hopeful that you already know about. Dunn County has worked with Krista and our other amazing IT professionals and GIS professionals to put together a data portal. This is taking data from the state site and it's putting on our Dunn County website so people can really follow along at home with what the data is doing here. I know that a lot of people have called for a lot of different pieces of information to be shared daily, some of it which I can't pull or can't share. But we are working to get the number that people are really interested in about recovered. So the state uses the metric if it has been more than 30 days since their onset, if they have been marked as symptom-free, or if their case has been finalized, and they have not died. That's an important caveat. Then they are considered recovered. And so my hope is that that data, it tends to be a little underrepresented, meaning we think we have more people that have recovered than typically what the data says for the state, but I think that that's okay. Hopefully that'll get pulled in and we can put that on our data portal here so that folks, if they don't have social media, can go to the Dunn County website and see where we are today. And I use that with air quotes. So the data for today is pulled at 9 p.m. the night before. So it says 79 confirmed cases today. I know that we have 3 more. We've worked them today. We know they're Dunn County residents and that they are positive, but they don't get captured because of course that cutoff is at 9 p.m. Something else you guys can see, and I think this graph is really helpful, is that trend over time. You'll see that we were at 29 cases for quite a while, almost 3 weeks. And then we have had a very steady and I would say increasing trend upward. So we had a doubling of our data from 29 to 48 within about 2.5 weeks. And I'm incredibly concerned that we will have an additional doubling within less than 2 weeks this next time around to 116. So that is my concern, but you can see that we're really jumping right now. Part of that is that we had confirmed cases associated with workplace, with gatherings. So we've had some festivities, family gatherings, weddings, bachelorette parties where we've had positives and we've identified them. And then we're testing their close contacts after they become symptomatic. And so we're very quickly identifying positives. The hope with that PCR test proving them to be positive for COVID-19 is that we don't have any secondary cases from them. So it would be tertiary from the initial index case. But it does definitely increase the numbers because we're finding them. I am continuing to encourage people to socially distance, and I know that that is hard as people want to be back in what is normal and spend time with family. Right now, we are working a cluster of cases that span 4 generations because it was a large family that spends a lot of time, as many families do, together. And the family, the grandparents had primary care providing duties for their grandbabies. And now we have 4 generations with positives, and that's just incredibly challenging when you look at the oldest in that particular cluster is in their late 80s. Very, very concerning. So, so within the portal, there's a couple of things that I wanted to point out. One is the gross numbers, and people want that quick snapshot, and that's sometimes what they want to know. But the activity level is a measure that the school districts and I are using very closely to indicate whether or not we need additional community-based interventions. And so you can find Dunn County right here. It'll take a second, but it will just highlight Dunn County, I hope. Fantastic. So you can see that this is a 2-week comparison. So how are we doing this week versus last week? Right now we have, in the 2 weeks, we have a count of 26 cases per 100,000. That gives us a burden of 58. Using the state's metric, that puts us at a moderately high rate, not the highest, but moderately high. But we have a statistically non-significant trend, meaning we're not seeing a change one way or another. I think our last one was 21 and this is at 26. It cuts off on Wednesdays. That's important to know. Overall, we're at high activity level. When we have a high burden and an upward trend, that says to me that we need to put in place significant community interventions within our school districts as well as within our community at large. And so that is a number that we're watching very closely. One of the things that I want to share is that they fixed my light, so hopefully I won't be lightless today. So one of the things that I want to share in this map is really that we have been a little bit of an island. We've been doing a little bit better than the counties around us. I would chalk that up to a little bit of luck, quite frankly. I would chalk that up to our rural nature, and there is some protective factor that we don't have the population density that some of these other places do. But then I would also really commend our business community for adopting a lot of the WEDC guidelines or WEDC best practice guidelines as far as keeping their employees safe and not having that community spread. And we have worked with a fair amount of businesses, both for contacts and disease investigations, and they have been very responsive to do all the things that they need to do to keep their other community members and their employees safe. Again, quietly in the background. St. Croix is working several clusters of illnesses in many different sectors. We are seeing cases out of St. Croix right now. We are also seeing cases out of Pepin. They had a fairly large employer impacted, and so we're seeing cases out of that. Eau Claire continues to see increases in a lot of different sectors. They are actively working and noticing when they have possible exposure associated with different private events as well as public events. And then Port La Crosse, really, again, seeing a significant increase. One of the things that many of these places have in common is a college-aged disease burden. And so in Dunn County, we buck that trend a little bit. Our cases are pretty evenly distributed from an older than 40 or a younger than 40. We have had more cases that were under 40 recently. And so looking in the last 2.5 weeks, our average age of new cases is 34. And as of, and before that, so for our total, our average age was 38. So we are a little bit younger, but not like what they're seeing in La Crosse, St. Croix, Pierce County, where it's really impacting our 20 to 29-year-olds. For us, it's distributed all across the decades. Okay, and then I wanted to share with that, that's just kind of our COVID update for the region. Any questions before I move into, so I've gone through local COVID response and our data portal, which you're looking at right now. And I wanted to talk next about preventing disease transmission through the use of masks and other non-pharmaceutical interventions. Any questions before I do that? Okay. All right, so with that, what I want to share with you to start is the, sorry for anybody who gets motion sickness, some of the non-pharmaceutical interventions that I've been talking about literally for 4 months. And so that's that physical distancing, keeping greater than 6 feet for more than 15 minutes. That's good hand hygiene. That is wearing a cloth face covering when that physical distance can't be maintained. as well as, staying home when you're sick and that kind of thing. So because of our quick increase in cases, I feel very strongly that we need to do what we can to keep our economy continuing and our essential workers safer. So with that, I have a draft mask advisory. So again, it's not an order. This is just public health best practice to wear a cloth face covering when physical distance can't be maintained. I intend to put that out tomorrow, but I wanted to hopefully have a fairly robust conversation with the board about your feelings around that. I want to give some data behind cloth face coverings, and I also want to share that we have an incredible amount of community support right now for cloth face coverings. You're seeing that with some of our multi-state businesses and some of our local businesses requiring patrons and clients to either use their online services or wear a cloth face covering when they're there in person. Additionally, we had a letter of support from the mayor's office here in Menominee, encouraging that the Dunn County Public Health Department use additional community interventions, including the wearing of masks when public spaces are shared. And so that's important to know. I'm just going to kind of clip through these. These should have been in your email as well if you wanted to read them in more at your leisure. This is a letter of support from all 4 school districts in the county, from Colfax, Menominee, and I'll just scroll down so you can see all of them, Boyceville and Elk Mound. And they have some specific requests that came in later today. So I would like to honor some of those requests and use some of their language and modify my health advisory to reflect that. But again, it is with the eye on the prize of having kids have as much in-person instruction as possible, keeping our level of illness low right now, so that we don't have that very high transmission or high activity levels that would give me cause for concern to ask for additional community measures. Additionally, this is Menominee Cares, and they put forward, again, a request that we support voluntary and potentially more mask use. They also have some very generous things to say about my department, who works their tushes off, and we really appreciate them. And again, the Menominee Optimist Club, asking that a requirement for masks be put in place as a safeguard, again, for our community, as they really do try to enrich the lives of children here in Menominee and Dunn County, so serving the youth of Dunn County. This one's a little hard to read, but again, it's in your email. This is from a teacher here in Dunn County, not identified by what district, but just recognizing that there are some things that they would like to see to make our staff in schools safer, feel safer, be safer. And one of those is mask use. There are some other requests in there as well. And I had a fantastic conversation with this individual, and they do feel very strongly for the community, that they want to keep the community and the kids safe. This is another email from an individual that has contacted both the city as well as myself. And they were speaking from their own lived experience as somebody that is still out in the community, but has some significant risk factors, and would like to see more being done in Dunn County, including mask use. And then finally, this was from an elected official in Menominee, talking more about mask use in the library as well as in government buildings, and supporting that. So a lot of support for mask use, and I will be honest, much of it was unsolicited, but some of it was solicited, and we had robust conversations with different government agencies. And so with the city of Menominee, they said, you know, we feel really strongly about this. How can we support that decision-making process for UKT? And I asked for something in writing, and so they provided that. All right. So with that, I do, Chairperson, or I'm sorry, Supervisor Morehouse, do you want to have conversation now or at the end of my overall talk? I'm sorry, I can't hear you.
The button on your headset is probably pushed. If it's blinking, it means it's muted.
All right, can you hear me now?
Yes.
Okay, good. Sorry about the buttons thing today. I think it would make some sense to do this, have this conversation now. And as I said, we didn't notice this as an action item, but I think it would be really helpful for KT and the health department for all of us to weigh in on what we think about this. I think everybody has an important opinion, and I think it would be helpful to KT if we could all share that. So let's just open up for discussion if we can. Anybody want to start? Anybody want to weigh in?
Well, hi, this is Bill.
Go ahead, Bill.
Okay, just real briefly, I'm really in favor of the draft that KT's put together. And I was happy to see this little report on the unsolicited input that she got. And one or two of them were surprising to me. So but that was in a good way. So I'll be real brief and say that if that mask, the draft that KT mentioned, I'm 100% in favor of doing that, and more if she feels necessary.
Thank you, Bill.
I'd like to, say the same thing that Bill did. Working in a school district, this is one of the things that we're grappling with. We put out a survey to our parents, and it didn't surprise me. I mean, we have people that are very for wearing masks, and we have very strong opinions of against wearing masks. But as a school district, we are, to try and keep our students and our staff safe. And so our plan is, it revolves around, okay, can we do the 6 feet apart? With masks, the American Pediatric Association is talking about 3 feet apart. Kids are adaptive. We have summer school right now. We have 21 students and they're wearing masks. They're not even batting an eye at it. It's just like, oh, okay, I got to put my mask on. So we want to keep everyone safe. And this has been proven over and over and over again that it is one way to do it. So I'm glad the superintendents came together. So, yeah.
Hi, KT. I was wondering if you could provide any randomized controlled trials that have proven the effectiveness of cloth masks?
Sure. So I think that's robust randomized controlled trials is one of those data gaps. And I think that's an incredible thing to point out. What we do have are some snapshots and some best guesses. So, the case study that I think that many of us have seen about Great Clips, it's a very small case study where we had 2 infected and positive, PCR positive hairstylists, I think is how they would call themselves. And then they worked with 140 folks in Springfield, Missouri at the Great Clips, cutting their hair, and we had no transmission. We did have transmission with one of those individuals with their close family contacts where masks were not employed, and then among staff, again, where they were in close contact without masks. That is by and large not a robust study, and I absolutely acknowledge that. There is some data, and I am very happy to pull out what we know now about mask use that has been put out and is actually linked in the CDC's website. So to give you more data to hang your hat on right now, I think if it's used properly, if the masks are used properly and they're not used in giving a false sense of security, so people are still using them in addition to social distancing and physical distancing, they don't hurt at this point. But I do understand your significant question, and I'm not dismissing that in any way, shape, or form.
Okay. Also, I'm all for encouraging and supporting community interventions that help with the spread of this disease and limit the spread. But I really want something that's proven to be effective. And everything that I've seen on my research for data proves that the cloth masks are not effective. Do you know of anything that is proven to be effective? And I can go through the data right now. I have all the studies. I actually have the CDC paper right here.
Sure,
And
thank you.
It's instructed and called Non-Pharmaceutical Measures for Pandemic Influenza in Non-Healthcare Settings, Personal Protective and Environmental Measures. It's dated May of 2020. Mm-hmm. This is based on science data, facts, not on predictions or feelings or opinions. And what made me concerned about the letters we received is I didn't see any data in there. And everything we've been doing thus far has been based on data and not on thoughts or ideas or opinions. So I hope we still take our responsibility seriously and that we're considering everything by data and facts. In the conclusion of the CDC paper, they state, and I quote, "We did not find evidence that surgical type face masks are effective in reducing influenza transmissions either worn by infected persons for source control or by persons in the general community to reduce their susceptibility." That concerned me because that's with a surgical type mask, so that would be even more better created than just a sewn mask. The study was supported by the WHO. That's also on here. So they are also in support of this and published this. I also have a recent article from June 1st, 2020 from the Association of American Physicians and Surgeons. They created this document the other day and published it, encompassing clinical trials and documentation from the WHO and other organizations. And they studied the transmission of SARS-CoV-2, a particle that is 0.125 microns. And they studied different areas, the droplets, the air currents, such as air conditioning and transmission, objects and surfaces, transmitting that way as well. They cited numerous studies, and I can send everyone links to any of them. And they gave their findings on each study because many studies have been done on cloth masks. The first study was done from the University of Illinois, Chicago, and they measured filter efficiency for these masks. All of the cloth masks and materials had near zero efficiency at 0.3 micrometers. Their conclusion at the university was wearing masks will not reduce SARS-CoV-2. They again concluded cloth masks will be ineffective at preventing SARS-CoV-2 transmissions, whether worn as a source control or as a personal protective device. If I go on to more of their studies.
Well, you know, I think, KT, if you would scroll down on your one sheet that you had from the current CDC, because CDC has changed their mind over time, and the CDC has new information, I believe, with all the things that the recent studies that back up cloth masks, because it has developed over time. What you're citing, you know, not to be negative or anything, but citing from May and June, it has changed. So
Right,
I've looked at Johns Hopkins, I've looked at Yale,
Yep.
I looked at a study that came out of, which I found was interesting. It came out of Australia, where they were saying that it was ineffective, but Australia as a country decided to do cloth masks and they saw a decrease in cases. So it wasn't a published study, but it was a study that was out there.
These are all published. I have a bunch more.
And as school districts, we are going off of published studies and what the CDC especially is recommending. And recommending right now for the CDC is to wear a cloth mask.
AT, do you want to weigh in on the document that you shared?
Sure. Sorry about that. I had to find my unmute button. So with the document that I shared from CDC, that is their most recent guidance and why they're asking for it. There are several studies at the bottom that are linked here. I think that there is some, I appreciate Supervisor Comrie's perspective, and I appreciate that there is absolutely a data gap around randomized controlled trials. I think that there is also a continued data gap about whether or not this is droplet transmission or predominantly droplet transmission versus airborne or aerosolization like influenza. And I think that that's really important because when we look at droplet transmission, there is some evidence that in large droplets that cloth face coverings do have a source control role. But I do appreciate what you're bringing forward, Supervisor Comrie.
On June 9th, 2020, Mary Van Kerkhove, the WHO technical lead in the COVID-19 pandemic from the WHO, she stated that counties that are doing detailed contact tracing are not finding secondary transmission onward from those cases, and that it's quote unquote very rare.
So I'm sorry, I don't understand that. Tell me that again.
She's talking about those that are asymptomatic, that aren't showing signs.
Sure.
But
So, and I'm not talking about asymptomatic spread, but I am talking about pre-symptomatic spread. And I think that those are different. I'm also thinking, I know that we have done county cases that are linked to pre-symptomatic spread and lightly symptomatic spread. And so I think that those are very different occurrences.
Another doctor, the director from the Center for the National Disease Center of Immunization and Respiratory Diseases, she stated, we don't routinely recommend the use of face masks by the public to prevent respiratory illness. She said this in January, and we certainly are not recommending that at this time for this new virus. The CDC also said regarding this, masks are not usually recommended in non-healthcare settings. However, this guidance provides other strategies for limiting the spread of influenza viruses in the community, such as covering your nose, using tissues, hand hygiene. And also, what? I'm sorry.
No, go ahead.
The New England Journal of Medicine. We know that wearing a mask outside of healthcare facilities offers little, if any, protection from infection. Public health authorities define as significant exposure to COVID as face-to-face contact within 6 feet with a patient symptomatic of COVID that is sustained for at least a few minutes. The chance of catching COVID from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic.
So Supervisor Cromrie, just I understand your concern about the lack of data. Is that concern sufficient for you to be concerned about a mask advisory in Dunn County?
Yes, I can't with good conscience inflict someone to mandate thousands of people to have a mask mandate or a mask protocol encouraged when there isn't proof that this works. There just isn't the proof. There's tons of proof that it doesn't work and that it can be detrimental. I have more than 10 more studies that has been studied.
Okay, thank you. Thank you. Appreciate that perspective very much. Others want to weigh in here? Yes, Supervisor Steen. You are muted. There you are.
Okay, I am unmuted now. I guess since the last month, I traveled for a week to Illinois. I've been watching what's going on across the country, and I've changed my position on the, I guess, seriousness of this situation and what we should do. And I guess I am supportive of this if it'll be helpful. And we are pretty isolated here, and we are experiencing some spike now. But if you look around the country, it's just a matter of time. And whatever we could do to minimize or help the people, our people, to slow it down or help control it, I would be in favor of. And that's where I'm coming from.
Thank you. Yes, Supervisor Kennedy.
I also feel that anything we can do at this point to slow this down, and especially the spread in Dunn County, because we have been so successful in keeping it low, is something to look into, and to possibly actually create a mandate at this point. Maybe not forever, but at this point when the spread is going faster and faster.
Thank you.
That's the way I feel about it.
Thank you. Sarah Schaefer, we can't see you, but I hope we can hear you. Would you like to weigh in on this?
Sure. Can you hear me?
Yep.
Okay. So working where I do, I'm testing people day in and day out, and that's pretty much my main job right now. I personally am 100% on board with putting a mandate in place. Anything that can lessen, I don't feel like it's anxiety necessarily. I feel like it would lessen, even with the data. When I have people sneezing on me all day, that's got to stop some of it. I feel very strongly about masks when wearing them. I'm afraid to send my kids back to school. I'm afraid to keep them home. I think anything we can do at this point to lessen the spread, I'm for. I understand the data is there with some of the masking and whatnot, but seeing the rise in cases that I tested myself in the last week has really, it's scary. Like Mr. Steen said, it's coming. So I think the fall is going to be an eye opener for us.
Thank you. Thanks very much. Supervisor Bjork, do you have an opinion on this?
He went fishing.
He might have gone fishing. Might have gone fishing. Yeah, we're not hearing him. Chairman Bartlett, do you have an interest in weighing in on this?
I support this. I realize that there isn't data to show that it does work. I don't know that the data is complete that it doesn't work either. I like to base most of my decisions on evidence-based, but things are changing so much in this that I think anything we can do will help. I believe there's more people out there that will feel less stress if more people are wearing masks than there are people out there that it's going to create stress because they have to wear a mask. I think we have to trust our our experts. In this case, it is KT. I support her fully in this. I had a somewhat of an argument yesterday with the chair of Barron County that how they could have their county board meeting in person, and when their health expert has said that they should have 25 inside. I said, you know, if the county can't follow our recommendations, how can we expect the public to? And I understand if a committee wants to meet, as long as they can keep it under 25 and we can spread out, but with masks. So I think we need to support our health department, and I think it's a good idea.
Thank you.
Can I interrupt for a second? A new person just came in with the number ending 7185.
I saw that.
Make sure.
This is Larry.
That's what I thought.
Okay.
Larry, we were asking for your opinion on the mask wearing advisory.
I've been listening to everything, but the Zoom has not worked.
Okay, sorry.
So I got it on my cell phone. Well, I think that KJ, we got to follow KT. My personal opinion is it's kind of a one focus in big environment, and but we're just talking about masks right now, so count me as thinking it's a good idea. But I think it's more of a personal, makes me feel better that maybe actually stopping any virus transmission. There you go.
Thank you. Any other opinions before the chair weighs in, even though she's not supposed to? Notwithstanding Supervisor Cromrie, and I do really appreciate the work that you've done in investigating the data, and I do realize that there are gaps, data gaps, but I wholeheartedly endorse an advisory on mask wearing to the extent that it could be strengthened by indicating the joint support of the school districts, the city of Menominee. I think that would be helpful. I think it will do a fair amount if you listen to Dr. Fauci and other experts in reducing the spread. And we certainly are experiencing a spike here in Dunn County. So what if we are able to do something that can minimize the spread, I think we should go ahead and do so. Is that at all help? Yes, Supervisor Steen.
I was just thinking that I don't know if we're going to have a vote on this or if we're not, but we should honor Jody's work and her opinion in that if we do have a motion to move forward with this, that it should be reflected that it wasn't unanimous. And there's room, and I appreciate you did a lot of work, Jody. And I don't want you to think that, at least from my point of view, that it was in vain. But I think we have to leave, while the majority might be in favor of this, we have to leave the information that it wasn't the majority or unanimous.
Yeah.
And so that, and unless I miss my guess here, Diane, this would be a advisory, not a mandate.
Yes,
so
that's correct.
Basically, we're as a board, I think the majority are in favor of it, and we're just saying that, but it all boils down to what the people want to do anyway. And there's more and more retailers that are not allowing you to come in their place unless you wear a mask. So I don't know if I muddied the waters here or not, but that's what I
No,
have.
you did not muddy the water, and I acknowledge the work that Supervisor Cromley has done. It was extremely helpful. This was not noticed as an action item. We are providing input for our expert at the health department. So we will not be taking a vote on this. Has this been helpful, KT?
Yes, absolutely. Thank you for the conversation. Thank you for identifying some of those areas where I can be more supportive to the decision-making process for the board. And then if it becomes an action item for you, at this point, I will put forward again an advisory, which is then not mandatory, but supports that personal choice to wear a mask in public, cloth face covering. Anything else before I go on to the next bit? Okay. I wanted to make you aware that Dunn County will be entering into an MOU with the Western Region Wisconsin Association of Local Health Departments and Boards, or WALDAB. And so that is a group of counties that have come together to say that we will support one another when we get overwhelmed with COVID cases. And this is incredibly important in places right now, like St. Croix and Pepin, where there isn't that bandwidth to do the contact tracing and the disease investigation. In this middle time, the state had contact tracing team put together. They have then re-entered their workforce in their normal jobs, not in health sectors, but in other state government capacities. And so there's this transition period where they don't have the support for contact tracing and in disease investigation to the level that many of the local counties have needed. There is some of this that happens organically. I've had many cases that have come to Dunn County as a Dunn County case, only to find out that they're going to school in La Crosse, or they still have their parents' insurance. And so that's the address on the lab, but we're working the case for another county. And so that is organic. We are continuing to build a state for that work, but this is a more intentional when we have a place like Pepin. The health officer reached out to me 2 days ago and said, I have a nurse and a half. Can you help me do some contact tracing? And I said, we will make it happen if we can. Know that I'm taking the MOU to my board for awareness tomorrow. We'll get that signed and executed after that quick conversation. Again, it is an emergency response MOU that we are going to support one another in not only the contact and disease investigation, but if there's other items that aren't billable through the state, that we will have an arrangement so where the county that's providing that support does receive some compensation. Any questions about that?
My excuse me, Katie, my only question was on the federal CARES support. How does that apply to a shared MOU?
Sure. So part of it is like that organic work that we're already doing, where if I have the case and we keep the case, even though it might be a Pepin County case or a La Crosse County case, those are the two examples I've given, then we would then bill through the state CARS system, which is what we do a lot of our billing against, and that money would then be passed through.
Okay.
This is something that can be reimbursed through the CARES funding. And so the amounts for reimbursement will be consistent with the amounts that are then allocated to contact tracing, disease investigation, and monitoring. So this should come out of everybody's CARES pot to support this work.
Okay, thank you. And anything else in your report, KT?
No, I did want to share the financial report if you guys are ready for that.
I think so.
Okay. So, oops, I don't think I'm sharing my screen just yet. Let me do that first. All right, so this was also emailed out to you. I couldn't get it to go into a nice PDF for you, so I apologize. You do have the Excel spreadsheets. Looking at our expenses and scrolling up, the vast majority of our expenses are salary and fringe. We do have some additional salary and fringe because we are doing more work and we are putting in more hours, specifically our public health educator, some of our admin professionals. Those will very quickly, now that we have in front of you the budget adjustment that will be moved from normal levy supported work to where it should be, which is in care supported work, because it is related to contact investigation, disease investigation, and disease monitoring. And then emergency preparedness. So some of those funding streams that you guys see today on our agenda, we will then be able to, because we've time tracked it all, say this is where this actually goes, and then we will see that reduction in levy support and see the appropriate grant funding support for that work. So I did want to point out that where we're over our benchmark, I do anticipate we'll see that come back in line as we bring those grant fundings streams into our budget. Revenues, we're about where I expected. We're just starting to see the tail end of our licensing for environmental health. And so that's not necessarily reflected there. This is from our licenses for retail food facilities, campgrounds, pools, that kind of thing. So that you guys have some awareness, we have had some businesses choose to not reopen with this licensing year. I think there's been some public notification of that around places like the Cat Cafe. We are also seeing a lot of business owners take the opportunity to start something new. We've had a lot of businesses come in and we're doing some, and by a lot, I mean a handful, because we are Dunn County. But that is starting to offset some of those revenues as well. Any questions about that? Yes, sir. I'm sorry.
Just two questions, KT. The reimbursement from the government for COVID stuff, we've gotten a fair amount of money already. Do you anticipate the reimbursement being fairly quick, or don't you have an idea?
So out of our CARS reporting system, and so that's no different than most of our state grants, and so this is pass-through dollars and the state is administering it. We have to then bill and then they reimburse us, and so it does take a couple months to get that all fleshed out, but we're committed to that process, and so hopefully we'll start to see those backdated, so up into June, expenses that we were able to time track and prove that we had accrued that are eligible expenses for contact tracing and the disease investigation. That should start to rectify itself with this next financial cycle. So I'm hopeful that in August, I'll be able to show you guys that difference.
Okay.
One other comment I have, KT, don't be shy about assigning COVID duties or for reimbursement. You can be as creative as you want to be, as far as I'm concerned.
Understood. However, we will still work with our financial experts here at the county to make sure that we're not doing anything sideways.
Yes, we will follow the rules.
Yes, yes, please do so. I don't doubt that you will. Any other questions about the health department budget finance situation? All right, then thank you very much, KT. Thank you. I think I will speak for the whole board in thanking you for the work that you've done and the leadership that you've taken over the last few months. You've done a really excellent job of keeping the community informed and keeping us informed. And I hope you know how much we appreciate the hard work, and please pass that on to your staff as well, because they obviously are also really working very hard and we appreciate it.
Thank you.
Welcome. Moving on, if we are ready for item 6, the Department of Human Services staff report. Chris?
All right. Well, I noted when I pulled up the agenda today that I had erroneously left COVID-19 response update on from last month. So that is an error, and I don't have anything additional to share unless anyone has a question about something that the department is or isn't doing at this stage of COVID response. But I did invite Bernie Allen, who is our nutrition coordinator for the senior nutrition program, to come and present to you some information about the nutrition program and some of the impact of COVID on that. It's been, Bernie did the same presentation for the ADRC Advisory Committee earlier this week. And I said during that meeting, when we did all of our disaster preparedness work over the years, we always anticipated an event that would be a start and a finish type event. So whether it was a natural disaster like a tornado or a flood, or it was a disaster, a kind of a man-made disaster like a fire or a building, something happening, damage to a building, things like that, that we always thought that it would, we planned for things like the senior nutrition program would be able to be operational. We could shift where meals were made or how they were distributed in a relatively short fashion. I don't think that anyone ever anticipated the need for preparedness that would last us for months and months and months on end. So our including the senior nutrition program in our disaster preparedness plan as an essential service was actually had some foresight to it, even though if it was potentially just inadvertent. But we did have it as one of our essential services. And as it's turned out for the folks who are receiving meals, who are homebound and who are of a more vulnerable population, it's turned out to be a very essential service. So I would invite Bernie to do his presentation. Bernie took over for our previous nutrition director, Babette Tunnyhill, when she retired in May.
Can I interrupt for a second, Chris? I'm going to need you to set me as co-host again so I can do the back end recording because my charter dropped again.
Okay, hold on a second here.
Thank you.
Okay.
Where are you? Okay,
It's an
you should be set to go.
very appealing picture.
Thank you.
No, it looks really good.
I love it.
Go ahead, Bernie. Thank you. We
Okay.
appreciate your being here.
All right, thank you. Yeah, thanks for having me. And I apologize. I know for some it will be a repeat, but I just put together a brief PowerPoint presentation on what's taking place for the Dunn County Nutrition Program currently, kind of some of the changes that have occurred in the spring and now what's happening during the summer. So going with that. The first slide I have here is just some of the meal sites that we're operating. The majority of these we are operating. So in Menominee, we have 2 locations. One is Tantera Apartments and the other is Hosford Ridge Apartments. And I'll discuss the sites in a little bit more detail in an upcoming slide. Colfax, we are serving food there out of the Grapevine Senior Center and delivering meals. O'Galley is normally a site that has been open in the past for congregate meals at the O'Galley Civic Center. However, they are currently not in operation. And Knapp is another one where we're serving food from Boo's Bar and Grill in Knapp, and we currently are not. Ridgeland, we do have meals that are being provided out of the Dairyland Cafe in Ridgeland. Excuse me. And then the Sand Creek, we do have a cafe there, and we're also serving meals out of the cafe. Okay, so focusing in a little bit here in Menominee, the 2 locations I mentioned are Hosford Ridge, which is an apartment complex right down in town here. And they're serving meals 4 days a week, Mondays, Tuesdays, Thursdays, and Fridays. They would normally be a congregate site where the individuals would participate in the meal in the dining room. But in the current situation, the meals are being served to the individual's apartment. So someone within the building is delivering them to each apartment. And they're averaging about just 10 meals a day approximately. The other site here in Menominee is the Tantera Apartments, which is close to the Marketplace grocery store and is our busiest site. So the meals are prepared at the Neighbors of Dunn County, and then they're transported to Tantera, where they're packed out for home delivered meals and then also for some carry out. So they are serving Monday through Friday. And as I mentioned, the majority are home delivered, but they are doing some carry out meals. And they're averaging 100 or more meals per day. So that's kind of a busier location for us. And on this slide, you'll just see some photographs. So on the left-hand side, the facility there is the Hosford Ridge Apartment Complex in the brown brick. And down below that is Mary B. She's the site manager there. And she is receiving her food from the Neighbors of Dunn County as well. And then normally she'd be serving the participants in the dining room, but currently she's packaging the meals. And then the staff there at the apartment complex is delivering to the individual apartments. And next to that, to the right of that, is the photograph of the Tantera Apartments main entrance. And that is the apartment complex that's near the Marketplace grocery store. And down below there's a photograph of some of our volunteers, and actually the gal in the white t-shirt, she's the site manager. And they are packaging food again, mainly for delivery, but they do have a number of people that participate in that complex. There's a lot of people 60 or older living there. And they just come down and they're able to pick up their meals at the kitchen. And Colfax, so in Colfax, we are utilizing the Grapevine Senior Center. We're serving meals there Monday through Thursday. And that food as well starts out at the Neighbors of Dunn County, and we have someone that transports it to the senior center where it's then packed up and most of that meal is going out, most of that food is going out in delivery form to the homes, but there are individuals that are capable of driving, and then they do participate in carry out meals. And they're averaging about 26 meals per day. And again, I have some more photos. So this is the crew that's working over at Colfax in their kitchen. The individual there in the center is the site manager. And then we have one of our delivery drivers in the plaid jacket and hat. And then we have another volunteer who's packaging food again to be shipped out. So everything has to be packaged individually and sealed up. And then the hot food is shipped separately from the cold food. O'Galley, as I mentioned, that's a photograph of the Civic Center that's in O'Galley. Normally they do have congregate meal dining 2 days a week. But currently we are still servicing that area with home delivered meals. And Sharon, who's pictured there, she is normally the site manager for O'Galley. But since she is not working there, she is helping out at Tantera. So that helps kind of balance out the number of increased meals that are being served out of the Tantera meal site. Excuse me, and I mentioned NAP. So we aren't serving food out of Boo's Bar and Grill currently, and that was actually closed prior to the changes due to the pandemic. But right now, these two ladies, Sandy and Kathy, are delivering meals. So we are packaging meals for them in Tantera and then getting it delivered to a location in Knapp. And then they have a route and they're serving meals Monday through Thursday as well. And typically they're serving anywhere from 13 to 18 people that live in Knapp. And the last two locations, as I mentioned, are our restaurant locations, and they have been established that way for a period of time. They were closed down at one period, and then they've reopened, and they are again serving the carry-out style only. So they are they're both small facilities, both small restaurants, so there isn't a lot of space, but what they do is package everything up for their seniors, and they are able to pick the meals up there at the restaurants. So Dairyland is about nine meals a day for lunch, and then Sand Creek Cafe is about 5 meals per day. And both of those locations are serving Monday through Friday. Okay, so some of the updates regarding the program. Our participation has increased. When I look back over the meal numbers for 2019, at least for the second quarter, we are currently up about 10% over the numbers in 2019. In this last quarter, we served 9,097 meals. And as you can see, the majority of those meals are going out as home delivered meals, but we still have about 20% that are carry out. The carry out scenario is mainly occurred during this pandemic. Normally we would require most of our participants to stay and dine in the congregate or senior dining center, but because of the situation, we are able to offer carry out. And this is Diane. She's working at Tantera, and that piece of equipment that she uses is one of the pieces of equipment we use to seal the containers that are used to ship out the food. It's called an Oliver machine, and the equipment that we use is actually purchased from a place in Walker in Michigan, not far from us. Okay, so as far as the process for the home delivered meals, during the onset or the beginning of the pandemic around mid-March, they discontinued the use of volunteers for home delivery. And at that time, the staff here in this building, the Department of Human Services, was helping them with the delivery. So their workload was reduced at the same time that we still needed to deliver meals, and in fact, quite a few. So we had a daily schedule of staff that was helping out deliver meals. Because of all the uncertainty and things that were happening, we didn't want to involve our volunteers, mainly because, as you read there, most of the volunteers are over 60 and some are significantly over 60. After we started to incorporate a number of new safety measures and kind of try to figure out the best way to get people food and still keep a distance and keep the driver safe and the participants safe, the staff at our department started to, their caseload started to increase. So the decision was made that we needed to transition back to using the volunteer drivers, and that just occurred approximately the second week of July. So they came back after the safety measures were in place, and we had a more scheduled routine. So I'll talk a little bit about some of those precautions and things that we've done. So we are, of course, using personal protective equipment by our staff, by our volunteers. We are using face masks. We are providing disposable gloves. And that would be, of course, the meal prep staff is already using those type of gloves, but now some of our volunteers are utilizing them as well. Or we are having sanitizer available on each vehicle when we're delivering meals, and of course at all the sites. So for example, if you deliver a meal to a participant, you get back in the vehicle and then use hand sanitizer between each stop. Practicing distancing is somewhat challenging at times. However, we do have some measures in place that we've communicated to our participants, kind of what our plan is and what our expectation is. So we've asked our meal participants to have something outside of their door, whether it's a a cart or a table or a chair, anything where we can knock on the door, make sure we interact with the participant, but at the same time, we're trying to avoid getting too close to our participants. So we're setting the meal down on the table or chair, step back, and then they're able to reach outside the door and just grab that meal without coming into close contact with our delivery people. So that's, for the most part, that's worked out fairly well. Excuse me, some of the changes that have occurred at the office. So for a long time, the building was closed and locked. And right now we are open by appointment only. So we are still able to meet the needs of the individuals that would normally stop by the ADRC for a variety of reasons. Of course, most of that's taking place over the phone, but we are setting up scheduled interactions such as I have listed here, picking up Ensure. So one of the items that we supply to the community on usually more of a needs based, but as Ensure at our cost. And there are individuals that are enrolled or participate monthly, so they'll stop by and they'll pick up Ensure. And so at this point, I'm just establishing a time that they've arranged to meet me, and then we're able to still provide them with that Ensure. Another big program that's taking place for a few years now is the senior farmers market vouchers. So seniors 60 and over, based on a certain income level, are able to participate in this program, and it entitles them to vouchers worth $25 to use at the local farmers markets. And normally in the past, they would just come visit us at the ADRC and fill out a form, and we would provide the vouchers. This year, we've been taking phone calls and getting the form started over the phone, and then we're mailing those out for signature. And then once we receive those back, we're sending out the vouchers in the mail. So a lot of people have actually liked that, so they don't have to leave their house at all. We take care of it and get that right to them. So those programs have continued throughout. Some of the changes, physically at the office here, as you probably see when you're out and about, most places have installed some type of barrier, as we have, and just making sure that hand sanitizer is very available to anyone that's entering the building and or the ADRC office. We talked a little bit in the last few minutes about grants. So I have just kind of a summary of the grant funding that the nutrition program has received. So these are funds that are specific to the programs that we are involved in feeding the seniors here in Dunn County. So the Meals on Wheels grant we received for $8,000. Then there was a Families First Coronavirus Response Act, $25,500, and then the CARES Act, the largest of these three, is $63,000. And so these funds have been utilized for employee wages. So as we pulled over some of the other staff to help cover our delivery routes, some of the money's been used to cover the wages. We've had increased food costs, increased participation, and also increased need for equipment and supplies. In some of those photographs, you see they're using different containers, bags, just a variety of things that are utilized to move food out the door and to our participants. So those are some of the locations where that money is being utilized. Any questions on any of the topics that I covered?
Any questions, anyone?
Okay. Thank you for your time. I appreciate it.
Thank you very much, Bernie. That was very helpful.
Welcome.
And we will get our screen back, and I think Sarah is with us.
Yes, can everybody hear me?
Yes.
All right, great. Does everyone have the attachments or the items that were included in the packet being the human services financials?
Yes.
I will
Everybody?
go, yep. I'll go to the last page of them, which is the last page of the expenses where the grand total is on. Right now projecting, I show we will be, if everything continues the way it is, we'll be at 13,131,380 for grand total expenses. The next two lines break down into operating and salary. If everything keeps the way it is, we'll be at $8,049,534 for operating, and salary will be $5,081,846. Again, that checks back to the 13,131,380. Our budgeted expenses for 2020, it checks back to the 13,131,000, and our budgeted revenue we have now with the additions of the additional grants, it looks like we will need 9,476,000. And then that leaves us with needing 3,654,646 in levy. So then, as Gary likes it, the computation back would be that we would give back $442,062.
Thank you, Sarah.
You're welcome. He always likes that total at the end.
He does.
Is there any questions on those?
I did a quick run through, although July is not complete yet, and there are some relatively large bills that come through at the end of the month. There's nothing in July's expenditures that deviate significantly from this. So as I mentioned in previous, and Sarah's mentioned in previous months, in many respects, we're paying zero staff travel costs, we're paying zero professional development costs, or very limited professional development costs. There were some decreases in some service areas initially, but those have pretty much rebounded. But our children's placements and our adult placements remain relatively in check. So there's nothing that's happening at this point in time that's dramatically changing that. And I also would note that giving up the goods to the board meeting, human health or county board meeting, but the audit report from last year will show that the Department of Human Services budget returned $900,000 last year to the general fund. So our projections of 800 and some odd $1,000 were pretty accurate.
Yeah. Well done. Any questions for, yeah, please, Jody.
So I think it's on the second page, the adjustment of $171,439 for agency contract salaries. Is that due to agency staff being needed at behavioral health services, or what is that pertaining to?
That is actually, so we operate this program called Comprehensive Community Services, and it is a program that provides wraparound supports and kind of a team, building a team around people who are experiencing either mental health or substance use issues. And it is a program that by our certification, Medicaid certification for the program cannot have wait lists. And so we need to serve all of the people that are, but it also is all the people that are eligible, but it also comes, it's the only program that we have like this that comes with 100% cost reimbursement to cost funding. And so that budget adjustment was to add 3 staff, but it has a corresponding revenue adjustment on the revenue side.
Thank you.
Any other questions of Sarah or Chris?
And I would note along those lines, for those of you who've heard the spiel many times about our wait list currently is at 2.
Awesome.
Yeah. So we have driven it down from over 100 to, well, between 80 and 100 to 2. Actually, kind of thanks to COVID, because some people just kind of weren't interested anymore, but.
Did I hear a question from someone? I guess not. All right, moving on to action items. Thank you, Chris. That was helpful. And Sarah, we appreciate it. We have 3 action items. Review of the June 2020 DHS vouchers paid. That was in your packet. I need a motion to note review of the June vouchers paid. Supervisor Steen so moves. Is there a second?
Sure, this is Bill.
I think Supervisor Cromery's hand was up before yours.
Okay.
Thank you. Any discussion, questions for Chris or Sarah? These are usually about the same. If there are no questions or additional discussions, all in favor?
Aye.
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 Any opposed? So the June vouchers have been reviewed. That is noted. We have 2 budget adjustments. Never mind that they appear in the same document. It seems sensible to do them separately. So there is a Department of Human Services budget adjustment in the total amount of $69,444. The background information is noted on the 3rd page. Could use a motion on this as well. Department of Human Services 2020 budget adjustment.
I'll motion. Or second.
All right, Supervisor Bjork, who's the second?
I'll second.
Bonnie Barker, thank you very much. Any discussion? All in favor, say aye.
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 Okay. And then for public health, fairly extensive set of budget adjustments. Total amount is $363 and $738. I need a motion to approve.
I so move.
Supervisor Steen, is there a second? Supervisor Kennedy, thank you. Seconds. All in favor, any discussion, questions, concerns? All in favor, please say aye.
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 Aye. Okay. And that is it. Unless we have, thank you. Unless we have any announcements or any additional questions that anybody wants to share or comments they wish to make, Supervisor Bjork.
I just want to make a comment. I was listening to the whole program, but I lost my Zoom. And whoever made the point that we really need to thank our county employees for the hard work they're doing, I wholeheartedly agree with that. And I think the stress level, well, they weren't hired to have this kind of stress level either. So congratulations.
For sure.
Hanging in there with us.
Yeah, I echo Supervisor Bjork. You all are doing a really wonderful job and we appreciate it, even if we don't say it often enough. Anything else? If not, without objection, we are adjourned. Thank you very much. Our next meeting is August 27th for budget, and bring your dinner and wear your jammies.
Everybody stay safe.
Stay safe. Thank you, everyone.
Stay healthy.
Thank you.
Bye.